Okay. Check 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You good? Okay.
Did you have your stuff up? Huh? You weren't there. No, I can't. Let me,
No, you should definitely do. I just
If they say go
the last minute.
and then you have to, yeah, exactly.
Use Google.
15 you don't need to
Backup number.
Oh, okay.
just leave it because I don't listen to it. It sounded so bad before.
Mm-hmm.
Yeah. So I go check again for the mic. Okay, good.
Hold on a second.
Check 1, 2, 3, 4, 5, 6, 7. Check 1, 2, 3, 4. It's good?
Mm-hmm.
She's not coming.
Oh, she's not happy.
It was on 6.
All right, I'll just keep it.
I mean, you know, they keep their things tight.
Yeah.
Really what's important
Yeah.
is not important.
Okay,
The thing you mentioned is probably like
Okay,
a side
perfect.
line.
I want to make sure everyone's still path is open.
You see?
Okay, perfect. Thank you.
Graham's gonna pack the fentanyl thing. Maybe we're gonna make it cheaper. Yeah.
Hey, Melanie.
The flow is here.
Bradley.
Yeah, that's what I'm saying.
Yeah, the flow is here. It's indispensable. It's not coming from the other side.
Sarah, Bradley. Still frame 6.
You do that? Son of a gun.
Is it bad?
Just want to make sure everything's still there. Still
Right.
verified.
So really,
Okay.
I remember back in Brazil,
Thank you.
the heroin used to come from Chicago. It was really cheap.
Hey, buddy. Welcome back. How are you?
Fentanyl. They've been mining that stuff.
yeah, man. Okay, I'm just gonna go next to folks. Like they don't care.
Hey, Bobby. It's Bradley. It's kind of studio. But it's good. Just want to make sure you
That
guys
is
are still
coolest.
on from the 12th.
Yeah. You're such a kid.
I didn't think I was until I started playing.
Yeah.
Just creep up on me.
6.
That's some $20. It's a great stocking stuffer.
In case anybody's wondering.
Yeah. Yeah.
Yeah.
Stocking stuffer.
The whole
mountain
or just the top part?
It's the whole thing.
Oh, that's sweet.
Just send me the link when Isn't that cool?
Oh no.
We have to have it.
Crescendo's the brand. Start looking at stuff for music stand accessories. Not like
You know,
mic
I
stand
tried that.
accessories
I couldn't find it.
in Amazon.
Even on AliExpress.
You know what? I probably went to B&H.
So that's the other thing. I started going to
There's
Amazon.
a wrong
Amazon's
place to
cheaper.
go for this stuff.
You know what I'm saying? Like,
You pay 3 times the price.
Let me see the name of it.
Okay.
Pay no attention to the guy behind it.
no, it's Amazon.
Yeah.
Yeah, it's like Amazon.
Crescendo, of course, is music.
Yeah.
Yeah, another place is Sweetwater. Sweetwater, they have
And then you can.
The macro's not very good. Like, $12. Yeah.
What a deal!
Yeah. The thing is, like on Amazon, they're marketing towards like 8th graders learning to play the tuba.
Right.
You know what I'm saying? They don't have to pay for
And they have to have their phone on their music stand.
No, also ones like iPads for like learning the stuff. It's like, we're in B&H, they're selling us. This is for, yeah.
If you go to a lot of performances,
Yeah.
I know the guys.
With European pros,
B&H.
The rock and roller?
Yeah.
The tricolor.
Oh, the.
Okay.
I got my. It doesn't box. They can go in and drink it.
Love my boss.
Yeah.
Yours.
Right.
That's where I do most of my ordering.
I would say B&H.
Adorama's.
Or Adorama.
My name's
Yeah.
Michael.
Adorama is owned by GMA.
Is it really?
Yeah.
Seriously? Adoram, well.
I was about to say Adorama's been a really good job. Lately on
It's
Bean
the
and
dude who owns B&H's brother.
I was gonna say like you're.
It's all the same
I
family.
think they compete.
Check, check, check,
Same
check.
family. They hate each other.
They go to the same synagogue.
That's good.
They do. Yeah.
They have a joint account.
In Germany, you know Trader Joe's, right? So Aldi, the family Aldi owns Trader Joe's. And Aldi is the biggest long-established
I think I saw some.
equivalent of Trader Joe's in Germany. And when their dad died, the two elder brothers came in without too much problems.
Sure.
Said, okay, look, why don't we split Germany in two? They created Germany North, I mean Aldi North, and Aldi South. And it was the sweetest transition.
They're here, right? What are we working on? I forget where I've seen it, but
Yeah.
I've seen one around.
Bring your own quarter.
If you
Oh.
You have your own quarters for the,
No, no,
just don't want it.
Oh.
Oh, yeah. You use the card and you take it out.
you get a quarterback.
It's same as the airport.
The house is definitely gonna interview his partner.
Oh, that's right. Try to be on my best behavior. Oh, that. Yeah. We're in plenty of Ivy Brook.
Yeah.
Look, don't think I'm being facetious. Here, turn around. Look how much notes I've made about your composition. In the short time that I've sat here, this is
Oh, there it is.
all just like literally watching.
Here we go.
Somebody losing
Heads up.
First of all, let me thank everybody for being here, and I think you all know why we're here, because of the Affordable Care Act and the Texas versus U.S. Verdict that just came out, which we think is absolutely misguided. It's an inhumane ruling. It's totally misplaced, misdone, misread, and construed. In my state, I can speak for my state, but I can speak on a broader too, but 800,000 West Virginians will be affected with pre-existing conditions. I got over half of my population almost is going to be affected one way or another. And to just say, hey, after this, you're on your own. And to put the insurance companies back in control playing God is not what we want to go back to, not what we intend to go back to. So we're going to be fighting that. We have a letter that all of us have gotten on this letter asking the President to make sure the Department of Justice does its job in defending the law. The law is still the law. They're contending that because the money was taken away with the tax cut bill, as far as the fines, that negated the entire piece of legislation, the Affordable Care Act. And the bottom line is it's still in place. It is still illegal to not provide coverage to people with pre-existing conditions. And trying to unravel this entire thing is absolutely something that we're going to fight. So also we're going to be resurrecting again our request to Live UC today will be based on having our legal department intervening on behalf of the people of America to make sure that we can fight this at a level that we think that would be needed to be fought and also be fair. So that'll be done this afternoon. But right now, I'm happy to have my colleagues with me, Senator Murray and Senator Wyden, who basically have the same concerns that we all have been fighting for. And it's finally come back to roost. And we were afraid this day was going to happen, but we were not unexpecting it to happen with the types of verdicts that the judge in Texas has been rendering over his course and his career. So with that, I want to present you Senator Murray.
Thank you so much, Joe, and thank you, Ron. Thank you all for being here. You know, families have been worried all year about Republicans' continued attempts to sabotage their health care, and they made it absolutely clear in November they want this to stop. Moms and dads want to stop holding their breath, hoping that their child's broken bone or a chronic illness won't mean financial ruin for their family. Women want to stop worrying that they'll have to pay extra on top of their insurance for basic care like birth control. Young men and women really fear being thrown off of their parents' health insurance policy. And patients want to stop slipping back toward the bad old days when big insurance companies had all the power and could discriminate against them based on age or gender or pre-existing conditions. But the attacks on health care haven't stopped. Instead, in the middle of these holidays, families are facing more uncertainty about the future of their health care. And it is all thanks to the Republican lawsuit that is intended to gut families' health care. So let's be absolutely clear. If this blatantly partisan legal threat goes into effect, that is the whole ballgame. Tens of millions of people have their coverage thrown into jeopardy. Important patient protections, like those for people with pre-existing conditions, will be thrown out the window. The healthcare system that our families rely on to find affordable, quality coverage and get the care they need will be thrown into chaos. And that is absolutely unacceptable. Now, we did hear a lot about health care from President Trump and Republicans in Congress as we headed into this November. We heard that Republicans cared about protections for people with pre-existing conditions. We even heard that every single Republican in the Senate wanted to keep them in place. But we also watched, and actions speak louder than words. We watched as President Trump and his party seized every opportunity for healthcare sabotage, and we are watching closely now what they intend to do. If Senate Republicans truly want to reverse course and protect families from this latest healthcare threat that they have created, they won't ignore the unbelievable harm that this ruling is going to cause if it goes into effect, or introduce bills that actually won't help patients or families. Instead, Senate Republicans can show they are serious by joining Democrats and supporting Senator Manchin's resolution, making clear that Congress never intended to throw health care into chaos. And the Trump administration, as Joe said, can direct the Department of Justice to defend families' health care like it should have been doing all along. So we really hope that our Republican colleagues choose to do the right thing, to choose common sense over chaos, and choose helping patients and families over partisanship. And I hope as we go into this holidays, they will join us in doing that today.
Senator Wyden.
Thank you, Senator Manchin. Thank you for your resolution. And Senator Murray and I team up on these issues because of our committee assignments. And let me give you just my sense of why Senator Manchin's proposal is so important. This needs to be put in the context of this being the next chapter in Donald Trump's sabotage campaign. It all began some time ago when the Trump administration turned off a lot of the advertisements, the public outreach about this program, and they crippled the Navigator program. The next step was to cut the open enrollment period in half. Now the Republicans want to overturn this law root and branch. Now, this chapter, as I say, the latest in the sabotage campaign, came out just hours before the end of open enrollment. In effect, again, a step that would sabotage families' access to health care. So I want to emphasize this point. Right now, as we speak before lunch today, somebody in America, maybe a single mom who doesn't get health insurance through her work, signed up for health coverage during the open enrollment period. But that single mom who's walking on an economic tightrope every day, balancing the food bill against the fuel bill and the fuel bill against her health care costs, that single mom, as of now, hasn't yet paid her first premium that secures her coverage. And she's wondering right now, given all the news and all the sabotage that has gone on, she's wondering whether she ought to pay that first premium. And we want women, men, everybody across the land from sea to shining sea to understand that as of today, that woman can still get her pre-existing conditions covered. She can still get her children's prescriptions covered. She can still have the peace of mind that comes with comprehensive health care. And we really hope that you folks who are covering this debate will really focus on what the three of us are talking about with respect to patient protections. Because this decision puts a bullseye on these issues of patient protections. And what's important to know is, as of today, every one of those patient protections that I've just described is still there for the single moms and everybody else who's walking on that economic tightrope. Now, we're not going to minimize the fact that there are Republicans who want to continue a burn it to the ground and run around the law. But we are going to point out that this scorched earth partisan legal decision is going to have real consequences. And with respect to pre-existing conditions, and this is something I feel particularly strongly about, because in my Bipartisan Healthy Americans Act, we got a lot of Republicans on the bill that provided airtight, loophole-free protection against discrimination for those who had a pre-existing condition. We got that in the bill. What Republicans are working to do is to get rid of that and go back to the days in America, the dark days, when health care was for the healthy and the wealthy. That's what you get if you allow discrimination against somebody with a pre-existing condition. If they're healthy, no problem. If they're wealthy, no problem. But that's what they're working on, and we want people to know, as I've indicated, talking literally about today, when moms might be making a decision about health care, the law is on the books, but we also want people to know that the three of us and our colleagues in the Democratic caucus, and we hope other members will understand that we've got a big battle coming up. And I'll just close with the fact one would think that Republicans would try a new approach following this disastrous outcome where they lost 40 congressional seats, in no small measure because of their misguided approach to health care. So we hope that, as Senator Murray noted, particularly in the holiday season, that the President and Republicans in Congress start listening to the American people and, for Pete's sakes, empathizing with the American people, empathizing with what they're really going through, rather than just looking for these ideological trophies. Senator Manchin, from my standpoint, you take a difficult question, I'll take a softball, but we've got the leadership with Senator Murray here too.
I just want to follow up very quickly. Being a former governor, and people believe, whoever believes, and it's hard to even imagine that people can believe that certain people shouldn't be entitled to have insurance just because they can't pay. I want those people to know you're paying anyway. As a former governor, we had people going to the emergency room. That's all they had for delivery because they knew they couldn't be turned away. We were delivering health care in America at the most expensive, least effective, position and time. There was no preventive care. There was no maintenance. There was nothing. They would just go to the emergency room. And you know what happened? Every state had to basically dip in and help every hospital and every rural clinic to keep their doors open. That's the way it was done. And that's what they want to go back to. On the other thing, if a person was working for a company they couldn't afford the co-payment, or working for a small company that didn't offer insurance, you know what they would get? Workers' comp. They would claim a workers' comp claim. They cripple and hobble into work, and that's the only health care they got at the most expensive cost. This is what it makes no sense. I'm usually one trying to find that middle, work things out. But if I've got deniers and people don't believe that a person is not going to use the health care system one way or another, and the only time they can use it and access it is a time of emergency, and you think that's a constructive way to build a healthier workforce, I'm sorry, I disagree. And we're going to fight you. And you're wrong on this one. We're hoping the president would see the errors of the people that have been advising him on how wrong it is to take this approach. And that's why we sent our letter. That's why we're going to try to intervene again. We're asking for a UC, and we think it's worth fighting for. And if we don't, then God help us all, because I can tell you, the dark ages are not that far away from us again, and it'll be worse than what it was before, because there won't be money to come and help basically the clinics and rural hospitals and all those. And that's where my state comes down. That's where most of all of us are fighting this horrible, horrible scourge. Any questions? Yes.
Senator Manchin, obviously, you just had that message to President Trump. Have you had a chance to reach out to him or anybody at the White House yet? I know of the three, the best likely odds they'll take your call.
Yeah. Well, I'm sure he'll take everybody's call. I'm the one that sometimes it communicates a little bit more. But with that being said, I have not, at this time I haven't. I will be sitting down, asking for a meeting with himself and whoever the president would designate to show how we can fix it. It'd be different if we didn't have a fix. We do. The fix has been really on Mitch McConnell's desk for about, what, a year? Mm-hmm. Close to a year. And Patty and Lamar, if given to themselves to be able to come up with something that we all agreed upon after John McCain voted historically that night not to repeal the ACA, we sat down and went to work. Patty led the Democratic caucus. Lamar led the Republican. We met every morning and came up with a fix. That would reduce rates 20 to 30% for the private shore overnight. So we're hoping that that'll be done, but we're going to sit down and say, Mr. President, look at, basically, I think Senator Wyden pointed out, just look at the American people, have they accepted it or not accepted it? You know, it wasn't used. I used health care, that's the only thing I ran on.
Just one second question. The timing of all this happening on Friday, one day before the end of the sign-up period, do you, I mean, obviously this would be very frustrating to you. Have you heard anything where some people decided not to sign up because of this coming out on that Friday
Well, they're
night?
scared to death, yeah.
I've gotten a lot of questions on that point, and that is why I very much wanted to kind of walk you through exactly what is going on in America this morning. This is not some abstract decision that somebody is going to campaign on in 6 months. You will have a single mom as of this morning who signed up for coverage during the open enrollment period. And she's trying to make a decision now about whether she ought to pay her premium. And what the three of us are doing, and we've been participating in open enrollment efforts and the like, is we want to say to that single mom, and I can't tell you how many of those conversations I've had myself. I want to say, ma'am, we want you to know there's good coverage available to you right now. There's something available that can help your family. It's true that Donald Trump would like to unravel it, but we're saying we're going to fight that every step of the way, and we want you to know as of this moment, when you're thinking about, sending in that payment, we want you to know there's good coverage available to you. And I can tell you, as we meet this morning, there are families across the country who signed up, and they're debating whether or not to send in that premium.
Can you describe the legislative vehicles? What's going to happen this afternoon as far as the UC request?
Want to talk about your-
What objections do you expect? And also, can you force a vote through a privilege motion? That kind of
Well, today, everything takes unanimous consent, so one senator can object and it won't move forward. But it basically is a resolution stating what congressional intent was in terms of the health care bill. This court decision was based on what they attributed to congressional intent. We need to make very clear congressional intent is the current law that pre-existing conditions and other coverage is not to be taken away by a court. That's what
Well, the reason we think it's so flawed is that the tax bill that they put the repeal of the mandate had nothing about repealing the code or the law or the words.
So we're
strictly about money.
We're stating what congressional intent is, so the court
You
knows.
remove the money, but you didn't remove the intent.
The only other thing I'll say about the legal aspect of this, I was the director of the Gray Panthers for a number of years, and my wife said she would marry me because I wasn't a good lawyer. I was like working on this senior citizens program. I can tell you from a legal standpoint, you are in a lot of trouble when even the Wall Street Journal editorial board thinks your decision went off the deep end.
What are your thoughts on something like Medicare for all? Because it seems like if the Supreme Court does knock this out, that might be the party coming.
Well, the bottom line is we can fix what we have in front of us. They're talking about Medicare for all, talking about one-payer system, all these other things. You can explore all of that and sit down and have constructive dialogue by all sides of the party and bringing people in. But you got to fix what's in front of you. Right now, we're dealing with basically life or death. In my state, over 800,000 people, 40% of my population. They want to know, are they going to have access? Are they going to be taken care of? That's all. So as far as to get into what you support and what you don't support, we've got to make work what we have in front of us. They don't even wish to do that. I don't know how you'd even have a dialogue or a conversation on anything else.
Can I add one other thought to it? The American people during this campaign season, I already talked about what happened in the House, where health care played such a big role. Many of them said, we would like to go further than the Affordable Care Act. And in particular, up at the top of the list is the effort to hold down the cost of prescription drugs. And the three of us and our caucus has concrete proposals on what to do about that. So we have heard loud and clear that the American people want us to go further. But as Senator Manchin and Senator Murray have said, the first thing you got to do is make sure people don't lose what they have today, the pre-existing condition protection, going back to the days when there was health care for the healthy and wealthy. And that's why, so you know what I'm thinking about as somebody who's tried to specialize in this field in all my time in public service, is that single mom out there today who's thinking about what to do given all this confusion. She signed up. She's wondering if she actually paid for it.
Well, also, I think also people are believing misnomers that a person with pre-existing condition is not paying. It's all free. That's not the case. They're paying, but it has to be affordable. It can't be just priced out of the ballgame. And where I come from, people, I remember so plain, people would say, I don't want to be a burden to my family. Have you ever heard that where you all live or where you came from? I don't want to be a burden. You know what they're telling you? I can't afford the insurance. I can't break my family and put them into financial ruins. So whatever the good Lord intends for me to happen, I'll just have to let it happen. And that's just, I mean, that's not who we are in the 21st century and superpower of the world.
Yes.
Any opportunity for a deal with Republicans to get this across? Something they're gonna?
Well, I think the point is that we just went through an election where virtually every Republican running said they were there to make sure that pre-existing conditions were covered equitably, that they didn't have to pay more for them, that this was what they believed in. We'll give them that opportunity today to make that very clear. We will continue to make that opportunity for them very clear. They will have to decide whether the rhetoric that they have been saying matches what they're going to do here.
Were you all aware of what they came up with after we tried to get this on before? And they said, and they knew that it was such a topic that touched so many people's lives. Every family has somebody in the family almost with a pre-existing condition. So their proposal that never hit the floor that a few of my colleagues were working on basically said, we will cover pre-existing condition as long as it's not the pre-existing condition you already have. Does that make sense to you? So if you had cancer, we'll cover every part of your health care except cancer because you already had it before. I says, that don't make sense in West Virginia. It doesn't make sense in Oregon or in Washington. It doesn't make sense at all. They were so basically, I think, embarrassed by it. It never came. It never came. That was their proposal. It never came to the floor. So we haven't seen a thing. So all we're asking for, you don't have anything else. Your intent was verbally, they tried to defend themselves, my opponent and everybody else that ran, that all know we want the same. Well, if you do, then drop your lawsuit. If you want the same, we already have it. Drop your lawsuit. And we couldn't get them to do it. So today we're giving them another chance.
And if there is an objection this afternoon, what
Right.
next? Try to force a vote next
Go ahead,
year?
Pat.
Well,
We introduce a bill?
obviously, we will not stop fighting this. But we're calling on them today, don't object to this. Let's put in place the promises that you all made. As Joe said a few minutes ago, this is what is in front of us right now. People facing this fear, and we can do something about it. Republicans have said they want to do something about it. Today's their opportunity. Now, if they choose not to do that, the heartless act that it would be, then we will keep fighting.
If
Alice,
go ahead.
what Senator Murray said, and Senator Manchin as well, is that, healthcare policy is big and complicated. We're spending $3.5 trillion this year. For the amount of money we're spending, you can actually send every family of four in America a check for $40,000. It's big, complicated stuff. But what Senator Manchin and Senator Murray just described are practical steps that would help people right now. So in this complicated healthcare universe where there's so much lingo and complications, Senator Manchin has a resolution that would help people now. Senator Murray talked about the ability to help people today, and that's why I have responded now several times to this whole question of what Americans who signed up but are wondering about what it means for them. I've tried to spell out in kind of painstaking detail why we really hope that they'll recognize that the law is still on the books and they can get help today.
Well, we'll finish up. I'll finish up real quick and just say this. We depend on you all to hold all of us accountable. Any of our Republican colleagues that object today, this afternoon, just ask the question. If you're objecting, what are you doing to replace it to keep the promise that you want to make sure that people are protected? That's all. Just ask that question to them. We've been trying to get an answer. They thought they would come up with something. They were embarrassed what they came up with and didn't even put it out. They still have nothing. So that means they're intending to leave us all hanging dry in all of our states and across this country. And we're just not going to do it. We're not going to sit back and let that happen. One more and we'll go.
Yeah, just going forward, there was a whole effort with scrapping the ACA on compromise. And all that's got you, as Dave Weigel put it, was a decade of the ACA being Calvin ball through the courts. So is there any point at this point trying to continue to compromise with the Republicans? Or should you just be looking at 2020 reconciliation and at Democrats figuring this out on their own?
Well, my people, yeah, but I've got people today that you throw this out in 2019. I'm not worried about 2020. I'm worried about 2019 right now coming within the next couple of weeks.
Of course, we're willing to talk about health care. Of course, we will continue to do that. It is a major discussion. What we're talking about today is a very narrow thing, which is pre-existing conditions and other protections of ACA staying in place, and a message to the courts that we expect those to stay in place.
And I'm standing before you in a state that was most challenged, where Donald Trump has 63% popularity, where he won by 43%. And I ran day in and day out for 1 year on pre-existing conditions, and my opponent at that time, was one of the attorney generals that signed a petition, one of the top leading proponents. That was so if you want, I'm standing before you because of this. So politically, I don't know how they would contend that. And then look at the House, what happened to the House. But guys, we're going to fight it. This is just wrong.
I want to just wrap up with one last thing. Is Senator Grassley and I, for example, have a bipartisan proposal that passed the House on holding down the cost of prescription drugs, the EpiPen whole question. The problem is you can get something like that passed, and then you see all the suffering that comes about as a result of people losing basic coverage in the ACA.
Thank you all.
Thanks.
How are you?
Am I zooming out?
We'll have a team.
You want her to? Right? Like, oh shit, I made a picture. And then they were just all way over there talking. Nice. Did you guys stream the whole thing?
They stream everything.
Oh, really?
Well, maybe not here. They have like 6 channels on this app.
Oh, really?
And they just keep streaming. They love it.